Welcome to your Tuesday tip. My name is Monique. Today I'm going to be talking about what to expect if you decide to get an epidural. So you might be wondering, what happens when you get an epidural? I'm going to tell you. An epidural is a form of pain control in labor that essentially numbs you from about here down. Okay, numb to feeling and like different sensations. That numbness, that tingling, that warmth, you're going to feel it all throughout your belly, all the way down to your legs. A lot of moms aren't able to lift their legs. Some moms aren't even able to lift their bottom. It depends on how heavy the epidural is, how much medication is going through your body, how your body responds. Essentially what that means is you won't really be able to feel the pain of labor. You might still feel the pressure. Some moms say that certain spots they aren't able to feel any relief from. So they have relief on their right side, but not on the left side. They have relief everywhere except for this spot, or usually a lower spot in the belly. It's very normal. Some moms don't have any relief at all. Every woman is different. So getting an epidural is a process. The nurse that takes care of you will have to call the doctor, the anesthesiologist, or the obstetrician to come perform that procedure. It's not performed by a nurse. Sometimes an anesthesiologist or a certified registered nurse anesthetist or a CRNA will come and perform that for you. They will ask you questions, they'll do a medical history on you, and then they will explain the procedure, get your consent, sign your name on the piece of paper. That's your consent. And then they will perform the procedure right at your bedside. What that means is you're gonna sit up, you're gonna sit on the side of your bed, facing like with your legs hanging off the bed, and you're gonna put your chin to your chest, shoulders down, and you're gonna curl over your baby. See this? Curling over your baby. Your lower back, if these are your hips, they're poking back that way. You're not leaning, you're curling over your baby. Okay. As you can see, it's not the most comfortable position because what I don't have, even though you can't really tell because I've got a belly here, is a baby in my belly. And when you're in labor, not only are you gonna have a person that's stopping you from going forward, you're also going to usually be having contractions so uncomfortable that you don't want to be in that position. You want to sit up, you want to stand, you want to move around. And that's expected. We expect that from you. But if you want an epidural, you really got to get into that position. You got to get chin to chest, shoulders down, curl over your baby, and then you have to stay in this really bad position, this bad posture, for the length of the procedure. That spot, which is in essentially your spine, is not the bones, it's the spaces in between your bones, is a really small spot. It's really, really tiny, okay? And just like when you're putting an IV in an arm, we're not using ultrasound or x-ray vision. We're using our fingers. The anesthesiologist or the CRNA is pushing and trying to find that spot while you're having contractions, while you're in that position, okay? So it's really important that you stay as still as possible. And again, I always talk about this with my patients. We get it. It's uncomfortable. There's a person, you're having contractions. It's a really ugly posture. But you have to. So the anesthesiologist or the CRNA is going to look for that spot. They're going to poke. You're going to feel the needle to numb up your back. And then you're going to feel like a burning sensation, kind of like flowering around that spot. Okay. After that is over, then the procedure can really begin where they put in the spinal needle or the epidural needle rather. It's not a spinal needle. That is wrong. That's for a spinal. But they will use an epidural needle to actually put in, place. It's a little thin tube, kind of like your IV. Okay. So in this instance, the anesthesiologist is they're looking for those markers that they're in the right spot, and then they pull out that needle and they leave in a catheter. Some institutions, you will have a continuous flow of medications and a button, like a little remote, that gives you what's called a bolus, which is a big amount in a short amount of time. It's really not that big, but it's more medicine. And some, like I said, some hospitals will just have that pump that's continuously giving you medicine while you're laboring. After the end of the procedure, though, you're going to lay essentially flat. You're not going to lay flat because you have a person inside of you, and that's not super safe. You should have the head lifted up just a little bit. And your nurse is going to help you with that. And then you're going to progressively, little bit at a time, feel warmth, heat, and heaviness from your legs up to your belly area. And I usually tell people, give it a good 15 to 20 minutes before you feel complete relief. And again, it's every contraction should feel a little bit better. Just a tiny bit better, until you're 15, 20 minutes in and you're like, oh, I had a contraction? Awesome sauce. And you don't even feel it. If at any time you're not, 20 minutes have gone by, 30 minutes have gone by, an hour have gone by, and you're like, I don't feel any pain relief, you need to let your nurse know. I don't think you're going to have any trouble letting your nurse know, but I always say that to my patients. Let your nurse know if you're not having any relief. Then after a certain amount of time, a lot of times nurses will wait until the epidural is really been effective and heavy, and you know that it's working well. That's what I'm looking for. If it's working well, then you'll put in a Foley catheter. A Foley catheter is, again, a tube. We're always putting tubes in you. Is another tube that goes into your urethra. So a lot of times at this point, moms are super heavy, like their legs are heavy and they're like, I can't feel a thing. So the nurse will pull your legs up, kind of like a cervical exam or a vaginal exam, and she'll put a catheter in to get the urine out. Because I didn't mention it before, but I'm sure that you know that with an epidural, you cannot get up and walk around. So you're going to be in bed, okay? Because you can't really feel, like I said, you can't really feel, you're not going to know, you're not going to have that feedback of, I have to pee. If you do feel like you have to pee, let your nurse know, because it's possible that you have like a kink inside your catheter, but most patients aren't able to tell whether they're able to urinate or not. So the catheter is going to go in. And then I always encourage people, just because you have an epidural, that doesn't mean that you aren't still in labor, which means you have to move side to side. So every 30 to 40 minutes, someone, if it's not you, someone should be encouraging you, okay, right side, okay, left side, okay, let's sit up a little bit. If the epidural is not too heavy, again, that just means that you don't have a lot of, like, the medicine isn't affecting you to the extent that your legs can't really move. So if it's not too heavy, sometimes you can even lift your legs and go onto hands and knees. Again, you cannot bear weight. That is not safe. I would not recommend it. Talk to your nurse, talk to your doctor, whoever. I'm not suggesting that you will have the strength to stand, but you will be able to maybe lift up your leg and go to one side. Okay, lift up the other leg and go to the other side. And what you're doing is you're continuing the process of labor moving forward with this epidural. So to recap, an epidural is a procedure where a needle goes into your back to allow you to have almost no pain while you're in labor. And the reason why I say almost is because some people still have that awareness that they're having contractions, but they may not ascribe the word pain to it. They might say, oh, I feel that. I feel some pressure. The needle that anesthesia uses, and I'm using anesthesia and I'm including anesthesiologists and CRNAs. So the needle that anesthesia uses, I always tell people, it's smaller than the ones that nurses use to put in your arms to start an IV. Okay, so a lot of people are like, oh my God, I'm so afraid it's such a big needle. It really isn't. It's smaller than what we have. What is so uncomfortable is the fact that you have to put your chin to your chest, shoulders down, curl over, baby, while contracting, while someone's poking your back. That's not comfortable. So you get that procedure. It doesn't take very long. You know, it really doesn't. It does depend, though. The length of time that it takes depends on you. So your mind, so can you keep still? Your body, how difficult is it for the provider to find those spaces in between your spines? The provider, him or herself, how knowledgeable are they at the procedure? And yeah, that's pretty much it. You know, if you're able to get into that really good position for them so that all they have to do is go, boop, there it is. You got 15 minutes and out, you're done. Some people, it takes 30 minutes. You know, that doesn't mean that anyone has done anything wrong. Maybe your spaces in the epidural, in your spine, are so small or so tiny that it's really, really hard for anesthesia to find it. Maybe you have scar tissue. Maybe there's something else happening. Maybe there's, a bend in your spine that makes it so that it's not super easy to get the epidural. When anesthesia comes and talks to you about your medical history, that's when you're going to tell them, I was in this car accident and I have a metal rod in my back, or I was told when I was younger I had scoliosis, or whatever, blah, 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 blah. And then maybe anesthesia will tell you, you know what, you're really not a candidate for an epidural. It's not safe to do it. Maybe your blood work comes back and it shows that, you have some blood work that makes it unsafe for you to have a needle in your spinal area. That's a thing. Talk to your OB, talk to your midwife, talk to the anesthesia and see, are you a candidate for an epidural? So that's kind of the ins and outs of getting an epidural from a nurse's perspective for you when you're in labor. I'm trying to think if there's anything else I might have missed. No, I guess the biggest thing is that just because you're in bed doesn't mean that you can't still move around. It doesn't mean that you're not still in labor. I didn't talk about whether an epidural speeds up later, slows down later, labor. That's going to be a different video. We're not going to worry about that right now. I just wanted to talk about what to expect when you get an epidural. Any questions? Hit me in the comments. Thanks. My name is Monique. That was your Tuesday's tip.